Thank you so much for taking the time to talk with us. A brief introduction. Dr. Blair is a general surgeon in the Department of Surgery at Johns Hopkins, and we all know Johns Hopkins has been at the frontier of combating the pandemic. So our first question is, how are coronaviruses transmitted between people?
Yeah, thanks for having me, guys. So coronaviruses are transmitted by close contact from person to person. That's why we hear all this important information about trying to keep 6 feet distance and social distancing. It's actually carried in little respiratory droplets. And so when people cough or sneeze or sing or talk or breathe, you spray some of these droplets out. And if another person were to inhale these droplets, it gets absorbed in your nose and your mouth, and you can become infected. So again, that's why it's important to keep a distance, cover your face and your nose with a mask, and to wash your hands and not put your hands on your face. And people who are infected but don't have symptoms can also still spread the disease.
Yeah, that's a really great answer. The second question is related to that is what symptoms COVID-19 specifically cause?
So it causes symptoms similar to a lot of viruses like influenza: fever, dry cough, tiredness, aches and pains, sore throat. Something that you may have heard of that's a bit unique to COVID-19 is a loss of taste or smell. Occasionally people can also get diarrhea from COVID-19. And then more serious symptoms, which happen maybe about 15% of cases, are difficulty breathing, shortness of breath, some chest pain, and need for oxygen even. And then on the highest spectrum, this comes with severe lung compromise, requiring mechanical support of a ventilator is what it's called, and multi-system organ dysfunction. And then, unfortunately, whenever anybody becomes critically ill and is requiring machines to help their organs function, that comes with many other comorbidities and complications like pneumonias and kidney injuries and blood clots, and it can lead to people being very sick.
All right, thank you. And then the next question we have is COVID-19 worse than the flu? And then is it worse than the flu?
So symptoms are similar, but unfortunately, yes, COVID-19 is worse than the flu. The numbers of people admitted to the hospital for COVID are significantly higher than for the flu, even when you're comparing to peak rates of hospitalization for influenza from prior years. And unfortunately, death rates are more than 3 times higher, and the requirement for intensive care is nearly double as well. It could just be because it's a more virulent or a more serious virus. It's also feasible. Some of this is because people have partial existing immunity to influenza from previous infections and prior vaccinations. But nevertheless, the measures to prevent the spread of both diseases are important because, influenza, people say the flu, it can mean lots of things, but real influenza infection can be very, very, very serious as well.
And then follow-up question: that is COVID-19 seasonal, like the flu?
Yeah, so that's a good question. It's yet to show real signs of seasonality. Maybe in the future it's something it could feasibly become seasonal, but unfortunately it isn't yet. We actually saw rises of cases in the hot summer months, when typical respiratory viruses dissipate. So it is not seasonal in its current state.
Thank you. Our next question is, if people are asymptomatic, can they still spread the virus to others? And if so, for how long?
So yes, if people are asymptomatic, they can still spread the virus. For how long? There have been some studies that have looked at the concentration. How we talked about how it's carried in the little respiratory droplets, and that's how it can be passed along to other people. And so there's been some studies where they look at respiratory droplets and the concentration of the virus in those droplets, and sort of see how long it takes for it to start to go down. So the concentrations of the virus are highest when the symptoms start. And from the time the symptoms start, they start to decline after that. And so studies have shown that at about 10 days from the start of symptoms, about 90% of the secretions don't have high enough concentrations of virus to be considered contagious. And at 15 days, it's about 95% are not high enough to be contagious. So because of these studies, the CDC suggests isolation for 10 days from the onset of symptom. And if you never had symptoms but just had a positive test, it'd be 10 days from the day of the positive test.
Thanks. I think that isn't a very widely known or recognized fact, so it's good to know. So another question: if you tested for COVID-19 after exposure to the virus and the result is negative, should you still quarantine?
So if you're in close contact with someone with a known COVID infection, you had a negative test, you should really still self-isolate for those 10 days regardless. If your job prevents you from doing this, you should physically distance, avoid crowds, wash your hands frequently, and monitor yourself for symptoms. Although really, everyone should be practicing that. So practice social distancing as much as possible and self-monitoring.
So for the next question, what is the possibility of reinfection after testing negative from COVID-19?
So based on what we know from other coronaviruses and from COVID-19, reinfection is possible, but these data are somewhat limited still for COVID-19 specifically. People appear to have at least about 90 days of protection before becoming even potentially susceptible. But again, it's still a bit unclear on how long people who have recovered against a previous infection are protected, and if they are reinfected, how virulent will that reinfection be, or how serious will the symptoms be the second time? It's still a little bit unclear, or maybe it is, and I just don't know. But from my knowledge, it's a little unclear.
Yeah, so on that note, of those infected, around what percentage will require hospitalization and what percentage will require care in an ICU?
So these rates are pretty variable. As you may have heard, the elderly or people with pre-existing conditions are at much higher risk for more serious symptoms. So a young, healthy person like you guys, it's probably around a 1% chance that your illness will be so severe that it requires hospitalization. And that increases to maybe around 8 to 10% for people in their 50s and probably 20% for people in their 80s. In our hospital right now, over half of the census of people with COVID infections are over 65, and three quarters of them are over 50. But that means that a quarter of them are under 50, and 1% chance of requiring hospitalization is still real when we're talking about tens of thousands of people that are being infected. We got to be careful, everybody.
All right, so next thing is how has COVID-19 impacted hospitals and medical centers?
So I think the most common thing that you've seen in the news or heard about is just the kind of the overload of patients. Our EDs and our emergency departments and our ICUs or the intensive care units are very full of patients that maybe aren't normally there. I think specific to me as a surgeon, we do take care of critically care patients, but also I think an important thing that maybe gets less coverage is that because we have all these people in our ICUs and our emergency rooms, we have to repurpose many of the units and the workforce that makes these things run. So there are current floors that normally are surgery floors that take care of patients after surgeries. And we have entire ICUs at Johns Hopkins that are focused on just patients that had surgery. And we have turned some of those over to now just taking care of patients with COVID. And so that means that the physical space, the nursing, the doctors, all of these are normally taking care of surgery patients and now are taking care of critically care COVID patients. What that means is that it decreases our ability to perform surgeries. And so we have to cancel surgeries. There's people that aren't getting their surgeries performed. We're still doing things like people with cancer and people that have emergencies. Those are all still getting done. But we have to cancel hundreds of cases. That means there's a backlog of cases that need to be done, and it's a serious impact on medical centers.
I feel like that's something that a lot of people overlook when thinking about COVID. And on a related note, what are the clinical standards for a patient to be considered recovered from COVID?
So the clinical standards right now by the CDC guidelines are, as we mentioned, 10 days of isolation from the start of symptoms and no fever for 24 hours. If you've achieved those things, then you're considered a recovered patient.
So we just have a few more questions left. Is there a period of guaranteed immunity after the virus infection? And how does this relate to like COVID-19 specifically? Is it different?
So based on what we know from other viruses, reinfection is possible, but people appear to be less susceptible to reinfection after initial recovery from the disease. And as I mentioned before, there's about a 90-day period where there's thought to be at least a strong protection. After that, at least my knowledge is a little bit uncertain. I'm not sure, but I do think that it's proven to be uncommon for reinfection, but not impossible.
And then for the next question, so far, how many different treatments and vaccines are there? So like of those, which are also the most effective?
So as far as treatments are concerned, for mild to moderate disease, a lot of this is now being managed at home. So people are monitored closely. A lot of times people are given oxygen saturations to make sure they can watch their oxygen, maybe supplemental oxygen if they need it. Rest, hydration, antipyretics, which are like, Tylenol to help with your fevers. More severe disease, what we do for the treatment, a lot of it, again, is respiratory support. So you give the oxygen, you can intubate and use a mechanical ventilator if needed. And then, as I mentioned, with the very severe infections come all these sort of complications with using these, being critically ill, having multi-system organ failure. So that it becomes a very complex treatment to manage all of these different systems that are no longer working. There are a few antiviral drugs that have been approved. Remdesivir is one. This is thought to be most effective early on in the course of the disease, but I don't think it's being used routinely, but it does have FDA approval. And then there are two vaccines as we speak now that have approval. It's the Pfizer vaccine and the Moderna vaccine. Those are the companies that developed them. And I think there are at least 3 others in phase 3 testing, so that hopefully will be available in the future. I guess a little bit on the Pfizer and the Moderna vaccines. These are mRNA vaccines, what they're called. They're messenger RNA vaccines. And this is a new approach to making vaccines. It's for doctor nerds, it's an exciting, interesting thing. This is technology and we've had the technology and the capability of making these for a long time, but this epidemic or pandemic has given us a chance to really use these technologies. And so what mRNA is it's the instructions on how a cell makes a protein. And so these vaccines have the mRNA instructions to make a part of the COVID virus, but it's a harmless little piece of protein called a spike protein that is on the surface of the virus and doesn't cause any issues, can't make you infected. So you take this vaccine, the mRNA produces this protein, and then your body immune system recognizes the spike protein, develops antibodies against it. And so then your body has prepared defenses should the actual COVID virus with that same spike protein enter your body. Then it would recognize the spike protein and destroy the virus, and you wouldn't get the infection. I think a couple of, maybe you'll ask about this, but a couple of common questions is, can this interact with our DNA? This sounds kind of futuristic. Am I going to turn into a virus if I take this? Is it going to mutate me? So mRNA goes into your cells, but it doesn't go into the nucleus. And the nucleus of your cells is where all the DNA is. And so it goes into the cell, into the cytoplasm, it finds the ribosomes and it builds the protein. And then as soon as the protein's built, the instructions just get thrown away and it's destroyed. So it doesn't interact with your DNA and it can't mutate you. And it's impossible to get a COVID-19 infection from the virus, from the vaccine. Some vaccines are, weakened viruses, and you maybe could get an infection from these. But this particular vaccine, it's just coded to make this little specific protein, so it's impossible to get the infection from the vaccine itself.
So on the note of vaccines and vaccination, what is a brief description of the current U.S. vaccination strategy, and which groups of people have been or are prioritized in getting vaccines?
Sure. So there's a limited supply of COVID-19 vaccine, but this will increase in the weeks to come. Something also that's excellent about this novel tech mRNA vaccine technology is that it can be produced very rapidly, which is great. And at our hospital, we've started giving the Pfizer vaccine in particular. The rounds of emails where they come out doing sort of a lottery of giving people the vaccines have been coming out very quick, and people are getting it quicker than I expected. But you're right, there's a strategy to this. First, healthcare personnel directly taking care of COVID patients, and people in long-term care facilities are kind of first in line to receive the vaccine, or the elderly at highest risk. Next is frontline essential workers and people that are just age 75 and older, whether or not they're living in a facility. Followed by this are people like 65 to 74 and those that are younger that have pre-existing medical conditions. And then it's the general public. So it is sort of a stepwise process, but that will be somewhat dependent on the supply, but that supply should continue to increase, and our ability to distribute it will get better and better.
So our next question is, when can the majority of Americans expect to receive a COVID-19 vaccine?
No, I'm not sure on the exact timing. As supplies continue to increase and all of these initial planned workers and those at highest risk are vaccinated, it'll certainly start to work its way down to the healthy high school students sooner than later. There's lots of steps, establishing the logistics, coordinating the distribution, ordering, processing, shipping, storing these things. The Pfizer vaccine in particular has to be kept very, very cold, handling them appropriately, giving them in a safe way, still maintaining social distancing, inventory, continued surveillance. All of these things are things that are have been teased out, but need to continue to evolve and improve. But the goal is for everyone to be able to easily get a COVID-19 vaccine as soon as large quantities are available. And the government has helped fund some of these vaccine manufacturers to help rapid production and distribution. In the interim, continue social distancing, cover your mouth and nose with the mask, avoid close contact, especially with people who are sick, and avoid crowds, wash your hands often, and eventually it'll be ready for you.
Approximately how many Americans would need to receive a vaccine for there to be long-lasting benefits in this pandemic?
So there's something called herd immunity, which may be what you're mentioning. This is a term that's used to describe when enough people have protection from the virus or from a vaccine, or from an infection, that it's unlikely a virus or bacteria can spread the disease. And as a result, everyone in the community is then protected. This varies from disease to disease, and I'm uncertain on the specific numbers for COVID-19 in particular. I think I had read something Fauci had mentioned there was somewhere between like 70 to 90%, which seems like somewhat broad and vague numbers, but it's still a pretty large number of individuals in the American public that do need to receive the vaccine for there to be long-lasting benefits.
So speaking to the general public, in your opinion, how important is it to get a COVID-19 vaccine, and why?
So I think the vaccine is one of the most important tools to stopping the pandemic. It's a safe way to help build protection to infection. And the combination of the vaccine and protecting yourself with social distancing and wearing masks is the best way to offer protection from COVID and to help end the pandemic. Get back to something resembling life as how we used to know it.
So you mentioned that the vaccine is using mRNA to create spikes, right?
Mm-hmm.
Some of the people that are not wanting to get the vaccine are afraid of complications due to vaccines. Even if they are rare, they are scared of the potential complications. Is there a higher, lower, or same risk of complications of a vaccine with the new use of the mRNA spikes?
Yeah, so it's a good question. So these go through rigorous testing. The most likely chance that somebody gets a complication from a vaccine is within sort of the first 60 days of getting a vaccine. And so even, there's a lot of people that say, this pandemic just started in February or March. How do we really know that these things are safe? but we do at least have a large amount of data. These were tested on 30,000 people under a lot of scientific rigor that they are in fact quite safe. The continued monitoring of long-term effects, I think, is important, but based on our knowledge of vaccines, the highest risk of having complications or problems after receiving is going to be in that early period. Most likely people get sore arms, maybe feel like they have the flu, but again, it's impossible to get a COVID-19 infection with this particular type of vaccine. Severe complications have been very limited. I'm not aware of them. I'm getting my vaccine on Monday, so I can tell you more about it.
So thank you so much for talking with us, and we really learned a lot today, and our community will definitely appreciate your expertise, and Happy New Year.
Happy New Year. All right, guys. See you later. Thank you.